shall never be to serve with our mind. One nation bound in freedom, peace and unity. Thank you very much.
Ably represented by the Honorable Commissioner for Health, our distinguished representative from N1, the National Coordinator Glaucoma Control Program, permanent secretaries here present, our royal fathers, Emir of Tuntuga, Senior District of Gombe, the District of Zambuk, our distinguished, our directors, deputy directors, our able politician president, that is Madam Rita of the Amen Healthcare and Empowerment Foundation, the officer in charge or our leading consultant technologist of the eye center of the special hospital, distinguished ladies and gentlemen, good afternoon. I'm highly delighted to be here in order to welcome you to all this important occasion. That is the flag off of glaucoma tricuspid surgery. We all know that the most important organ to human being is the eye. Because the eye is your only window to the world. Anything around you, you cannot say anything about it without seeing it. So if we help somebody to gain insight, it is an intervention that will impact heavily on his life. So we are glad enough, Amen Health Foundation, supported by other donor agencies, have taken the responsibility to conduct surgeries on all cases of glaucoma tricuspid in Gombe State. So we are here to plan up the exercise today, and by the grace of God, it will cover the entire state. So we welcome each and every person having time to come here in order to utilize the education. And at the end, I wish each and every person safe journey back to our destinations.
The Honorable Commissioner, Minister of Health, Dr. Ishai Kennedy, esteemed partners here present, loyal fathers here present, the Chairman and the Executive Secretary of the Primary Care Development Agency, the Permanent Secretary, Minister of Planning, and all other distinguished ladies. Allow me to stand on the already established protocols. Let me start appreciating Almighty God for giving us the chance to be here and to flag off this particular exercise of the outreach that is going to be carried out by Army Foundation. We are indeed grateful to the Federal Ministry of Health for supporting this project. We are grateful to our partners that are sponsoring the project. We are also grateful to the Gombe State government for creating an enabling environment for us to operate. We are very, very grateful. While this flagging off is going to take place, I wish us a successful outreach in Gombe State. Army Foundation has been here. This is not their first time they have been here. This is the third time or more than that. We thank you very much, Army Foundation, for coming to help us do what we are supposed to do in the healthcare project in Gombe State. We are so grateful. I thank you also for having the courage to be in Gombe, despite all odds. But I guarantee you that Gombe is a very peaceful place. So I wish you a successful inauguration. Thank you and God bless you.
Permanent Secretary, Ministry of Health, Director of Presence here. Our Royal Fathers, District Heads, the President and Founder of Ame Healthcare and Empowerment Foundation, donor, End Fund, all of that will be I want to stand on the already established protocol. I bring you greetings from Honorable Minister of Health, and my board, the Director of NTD, has asked me to just say a few words. Trachoma is a blinding disease, and we have about 112,000 people that will need surgeries to be done in 16 endemic states in Nigeria, and Gombe State happens to be one of those endemic states, and Gombe will need over 17,000 surgeries to be done. So I want to say the Federal Ministry of Health is committed in supporting Gombe. The President and Founder of our Health Foundation has been on our neck at the Federal Ministry of Health that we must do something. It's not as if we've not been we don't want to do anything, but you know, anything we intend to do, we need to take our time before we bring out any policy statement. So I want to say the Federal Ministry of Health is committed in supporting Gombe, seeing that we achieve elimination, that those over 17,000 persons that need surgeries, that those surgeries will be carried out. And by the time we get to when WHO will validate countries of having eliminated trachoma, Gombe will be among those states where we'll be able to say, yes, we've eliminated trachoma. So I in particular am very happy to be in Gombe, to witness today. And once again, I want to say the Federal Ministry of Health is committed, both technically and otherwise, to see that we support Gombe in achieving this. Thank you very much.
The Executive Governor of Gombe State, Dr. Ibrahim Hassan Dankambo, duly and ably represented here by the Commissioner for Health, Dr. Kennedy Ishaya, our royal fathers here, our dear Emir Pindika, our senior district head, and the district head for Zambuk, the commissioners here present and represented, the chairman of the Primary Healthcare Board, the executive secretary of the Primary Healthcare Board, the representative of the Federal Ministry of Health, Dr. Nicholas Olobio, Ms. Kali Kongdom, representing the End Fund, our dear sister, the Permanent Secretary for Health, other senior government officials here representing Ministry of Education, the Permanent Secretary for Ministry of Economic Planning, our team led by Dr. Lawali, the AME Foundation team, our clients, our press, the press, ladies and gentlemen. I hope you can hear me without. I'm really, really delighted to be here to flag off the free trachoma tracheasis surgeries for Gombe State. As some of us who are not in the medical field may not know, trachoma, TT, tracheasis, can lead to blindness. It's not only onco and cataract that leads to blindness. When people have trachoma, tracheasis, that is not quickly attended to, it can lead to blindness. And the Federal Ministry of Health has told us that this state has almost 17,000 people who are at the danger of getting blind from TT. And we have been told that if the whole country eradicates trachoma and the burden we have in Gombe is not clear, this country will not get certification. This is why we all have to do something to ensure that this burden is cleared up. Not only that, I have seen that patients who have this condition are really suffering. The eyes are itching, they are uncomfortable, they cannot go to public places like us because the flies are after them, and they cannot engage in productive work. And so, it becomes imperative on all of us, not just the Federal Ministry of Health, not just the Ministry of Health or the Primary Healthcare Agency and the foundation, but each of us has a role to play. And in carrying out this program, we have to work with our royal fathers, our community leaders. And this is why we have invited you to be here today, so that you will see the very great importance you play in all these programs, because they are community-driven programs. We were told that 5 LGAs in the state have the highest burden, and they are Yematudeba, Nafada, Funakai, Kwame Duku. These are the local governments with the highest burden. We are told that they have thousands in these LGAs. So we are starting from Yematudeba, then we will move to Funakai, Duku, Kwame, and the rest. Of course, we are going to go to the remaining 6 LGAs, but we are just prioritizing. And we cannot do this without the help of everyone. With the help of the Federal Ministry of Health, with the help of our donors, who have helped us to kick it start, and with the help of the Primary Healthcare Agency, where we have the entry into the state, and with the great support of the Ministry of Health. The Commissioner for Health has been very supportive, as is evidenced from this. We have been conducting surgeries here since October with the help of the Department of Eye Care here at the Specialist Hospital, led by Dr. Lawali and his very able team. The Federal Ministry of Health has supported us further by training 4 TT surgeons and 8 assistants, and this will be the core team we'll be working with through the state. And we are going to be calling on the Commissioner for Health, because this is going to be like an emergency program where we will need to engage these TT surgeons to work around the clock, because to do surgeries for 17,000 people across the state is not a small job. So we will need to engage them on a very regular basis to ensure that we are able to clear up this body in no time. I would like to take this opportunity to state that the state government has come to the support of this foundation. We have been here since 2015, conducting house-to-house treatment of everybody above 5 years to prevent neglected tropical diseases, giving drugs to prevent elephantiasis, schistosomiasis, soil-transmitted helminths, and onchocerciasis. But the government has now said, we have seen what you're doing, we are supporting you, and they have given us some grants. And we intend to make judicious use of it by ensuring that this TT that is really a burden, because we got some grants from our funders because we told them we cannot sit here and watch people suffer and not do something. Now that the state government has come out to support it and the federal government has pledged to support us, and they have indeed started by training our staff, we are sure that we can move faster. I would like to say that AME Foundation is also here to conduct some other programs like the cataracts, the distribution of glasses, which we did in 2017, and we are going to continue that in earnest. We are going to train people, and we are going to ensure that there is a screening center in every LGA to take care of cervical cancer. We want to nip it in the bud just as it is starting. We don't want a situation where people come down with cancer before we begin to run helter-skelter, which will be too late. And I'd like to say that we are really, really grateful to the people of this state because we've enjoyed a lot of peace in this state, and we have enjoyed a lot of support from all the line ministries, Ministry of Health, the Primary Health Care Agency, Economic Planning, Information, Water Resources, RUASA, Environment, and Information in particular is our special partner because every program we do, they are there with us, showcasing what we are doing all over the communities. I'm sure those who watch Gombe TV will be seeing our activities when we are doing MAM. And Progress TV has always been there for us, also highlighting our programs. I would like to take this opportunity to thank everyone most sincerely, especially our royal fathers who have been there for us. We specifically and deliberately chose this tree because from day one they have stood by us. They are there with us, and our prayer is that the Lord will keep you, you will live long, your reign will be successful and peaceful, and the Lord will prosper you. And we want to thank all our big bosses from the ministries, our Commissioner for Health, our Permanent Secretary, all of you, the ES who goes to the field with me. Every day we are out there monitoring, and our DAF, the former, the past retired Permanent Secretary, who is now an advisor to AME Foundation. And he was chosen to be our advisor because of the love he has always shown to this foundation. And I would like to also specially thank the Permanent Secretary for Economic Planning because he's one person I can call anytime, day or night. And he's always there for us. And through you, I want to send our sincere thanks to the Honorable Commissioner, Alaji Daladi. I want you to please thank him because he has always been so steadfast and very supportive to this organization. Without you all, we cannot do anything. And of course, the chairman of the Primary Health Care Board. Of course, we know that the policymakers are the ones who shape the attitude of the people in such organizations. And he has always been very happy to see us. I've met him a couple of times, and he's always expressed support for us. We thank you very much, sir. Thank you all. Thank you all.
To the Honorable Commissioner, the Permanent Secretary, the Federal Ministry of Health, the Gombe State Ministry of Health, the Primary Healthcare Development Agency, and the founder and president of the Online Healthcare Empowerment Foundation, Mrs. Rita. Thank you so much for having me here today. I'm honored to represent the End Fund at this event. Flagging off this program is really exciting for us. We've been really proud of the progress made by the Amen Foundation along with the Ministry of Health and the Gombe State Primary Healthcare Development Agency to control and eliminate NTDs in Gombe State. And incorporating this program for TT surgeries is just one more step closer to meeting the goals of control and elimination in Gombe State. The End Fund is committed to helping all of you achieve that goal, and we're really thankful for the part that each one of you plays in doing that. And we wish great success to this event and all of the others in the future. And I just want to reiterate the importance of this program to meeting not just Nigeria's control and elimination goals for NTDs, but globally, the progress that many countries in the world are making to control control and eliminate these diseases, which is very important to the health of people everywhere. So thank you so much again. All of you play such an important part in this program, and we could not be more appreciative to have you here today and for everything else going forward, for all the hard work. So thank you very much.
In the name of Allah, the merciful, the compassionate, and glorious. Your Excellency, Executive Governor of Gombe State, Alhaji Ibrahim Muhammad Gombe Hassan, ably represented by the Commissioner of Health, Royal Highnesses, donor agency founders of this program, all other protocols observed. Mine is just a short, very short historical background of this program. If you could recall all, around 1960s, this program started somewhere else in the former northern region, and here in Gombe State, if you go to former settlement of Lubo and Kodong, this is where we fought this crisis. Both alcohol, schistosomiosis, and other infectious diseases. However, due to some reasons, this program ended without any continuity. But here at the moment, we would like to take the opportunity to thank the foundation of this program for promising us about 17,000 people will benefit from this program in Gombe State alone. However, what we need here is a continuity and continued assistance, both by providing technical know-how, provision of drugs, provision of materials, provision of other equipment in order to carry out as a stated program in Gombe State. Gombe State is always happy and partnering with every organization and donor agencies in order to take care of our community and our people. So we thank you very much. We thank the state government, more especially the outgoing governor, Alhaji Dr. PhD Ibrahim Muhammad Hassan Gombe, for concern shown in the health sector and support. So the donors and founders, we have no word to thank you, because I am one of the greatest organs in the body, more especially in the way of seeing, even touching. Without eye, without seeing, without everything, you cannot even be lead or led. So we thank you very much. Hope this program will continue, and I promise you that the agency of the state primary health agencies will collaborate with you, work with you, and also wherever you want to go, we are ready to send our personnel to assist you within the state. Thank you, thank you, thank you.
That has been the chairman.
As President, Permanent Secretary President, permit me to stand on the existing protocol. I'm Yusuf Abubakar Muhammad, Deputy Director of School Services, Ministry of Education. I'm here representing the Honorable Commissioner of Ministry of Education in person of Alhaji Abdullahi Shaku, Chairman Akko, whom is attending another program in Abuja. Alhamdulillah, I'm very much delighted to be in your midst today to witness this occasion, whereby, inshallah, Health Foundation is going to deliver a free GT surgery. Alhamdulillah, we appreciate that. And we pray and hope that Allah subhanahu wa ta'ala will reward the donors, the supporters, the NGOs, and all that have something doing in one way or the other to see the success of this free TT surgery. I would like to say that I want to be excused because I'm having kata. So thank you very much. Thank you very much. Thank you very much.
The Honorable Commissioner, Minister of Health, who is also ably representing His Excellency, the Governor, Dr. Ibrahim Hassan Dankombo, the Permanent Secretary of the Ministry of Health, the Chairman of the Gombe State Agency, and the Executive Secretary, retired but not tired Permanent Secretary who is an advisor, our dear Royal Fathers. We like also to appreciate you for this very strong support that you have given us. When MN Healthcare Foundation came and started collaborating with Gombe State, the Ministry of Economic Planning was the first port of call. As a ministry, there was also for coordinating development partnerships. We ensured that what they plan to do is in line with the needs of the government. And actually, it was in the needs of the government. We informed the government accordingly, and then they also gave us the go-ahead that we can continue to partner. So we also want to thank the End Fund for providing the funding. And we want to thank the MN Healthcare Development Foundation, led by the President, Mrs. Rita, for this very strong collaboration. We in the Ministry of Economic Planning are always available with the enabling environment provided to us by government to ensure that any partner that comes to Gombe State is properly fitted and is doing a project that is in the interest of the people of Gombe State. So on this note, distinguished, respected gathering, we want to thank you all for this opportunity. I pray that at the end of the day, we'll all be back home safely. Thank you and God bless us.
Your Excellency, Dr. Ibrahim Hassan, represented by the Honorable Commissioner Minister of Health, His Royal Highness the Emir of Kandiga, the Senior District Head of Gombe, the District Head of Abubu, please permit me to stand on all existing protocols. Actually, I'm here representing the Chairman of State University Education Board, Professor Muhammad Burana Nku, who is absent on a very special assignment. However, being here, I'm so moved with this program, and I want to thank the organizers, particularly the executors of this program, more especially the representative of the Minister of Health. We thank you very much because from my mean calculation, I understand that we, the basic education board, are going to be the beneficiaries of this 17,000 population. Because when you are not blind at a certain age, the tendency of being blind is no longer there. So I believe this program is targeted to our students. So we thank you very much. I wish all of us safe journey back to our respective places. And thank you very much for this organization. May God bless us all. Thank you.
Gentlemen and all the people that have a stake in the healthcare project, a very good afternoon to you all. It is my singular honor and privilege to invite the representative of the Executive Governor of Gombe State, Ibrahim Hassan PhD Tolo Gombe, in person of the Honorable Commissioner Minister of Health, Dr. Ishaya Kennedy, to give his honor address. The Honorable Commissioner, sir.
Allah ka ba mu lafiya da abin da lafiya ba ta ci. Allah ka ba mu dare da gajin kajin. The Honorable Minister of Health, ably represented by Dr. Charles, the Executive Chairman of the State Primary Healthcare Agency, our grandfather in the health profession, Baba Yaya Amari, the Permanent Secretary, Minister of Health, Permanent Secretary, Minister of Economic Planning, and other Permanent Secretaries here present, the Acting Executive Secretary, State Primary Healthcare Board, Directors of the State Primary, the State Primary Healthcare Agency, and Directors from the State Ministry of Health here present. Our development partner, here I want to make mention of our sister, Kali London. Our implementing partners, Amen Foundation, special advisors, special assistants, security agency from here present, our royal fathers, members of the fourth estate. Good afternoon. It's not only a matter of confidence, but it's a matter of trust that His Excellency, the Executive Governor of Gombe State, Dr. Prime Hassan Domkoko, OON Program Gombe, has called on me as a coach chair in his court to come and represent him on this grand occasion, the occasion of the flagging off of eye surgeries in the front of Gombe. Permit me to appreciate God for the peace we are enjoying in Gombe State. We've been the only state in the northeast of region that has not been disturbed by the humanitarian crisis. But we are in another way disturbed by the humanitarian crisis. We are a city of refuge, and for that reason, people troop in to take refuge in our place. And while people move in terms of humanitarian crisis, it's not only breakdown in law and order, there's also breakdown in unity, breakdown in family cohesion, breakdown in almost everything in the health sector. Trachoma and other eye diseases that are highly contagious came in with people who move into our environment to take refuge. His Excellency Dr. Ibrahim Hassan Namkoko saw it as a matter of importance to consider the health sector and give it priority as we've never had it before since the inception of Gombe State. We've had 22 hospitals, the government house clinic, Secretary of Assembly clinic, police clinic, military field ambulance. Now 2 other clinics are coming up in the state SSS and NAFDA, all supported by the state government. We've built in 2 more specialized hospitals, a women and children hospital to take care of women and pregnant mothers, a snake-bite hospital to provide services to victims of snake envenomation and other arachnoids. We've also improved on the leprosarium in Zambuk to become an infectious disease hospital where tuberculosis and multi-drug resistant tuberculosis are addressed and taken care of. It is indeed a noble movement. Here I want to make mention of our grandparents in the medical profession. Baba Yaya Amari, whom I've made mentions a long time before, as one of the pioneer members who piloted what is now called State Primary Healthcare Government Agency. I want to mention our grandfather in the medical profession and appreciate him, to tell him that he's only here to see what he began. I remember the senior district head of Gombe was driving in what was then called a short-frame British Land Rover, moving from village to village, teaching people about hygiene, teaching people about washing faces early in the morning, teaching people about washing hands before eating food, washing hands after leaving toilets, to the point they established the margin. With population dynamics, the margin only moved to this place, and this place still remains the margin. Population dynamics in Gombe is very important. The fertility ratio of an average woman in Gombe is 5.5%. The population of women within the fertility period in Nigeria is about 45%. This gives us a very significant increase in the number of people in Gombe State per year because of the number of women who are likely to put to bed. This one has been complicated by the movement of people from other states to settle in Gombe. So the population has exploded. But something still remains low. Resources and revenue still remains low. Internally generated revenue is low. With the humanitarian crisis, more is spent on security, more is also spent on social infrastructure. Social services like the hospital service we are now enjoying has also been overstretched because at the time of planning, the Ministry of Planning has only planned for the population in Gombe State. Now we are taking care of populations for the Northeast sub-region. For this reason, I want to appreciate the founders of N-Fund, Mr. Charlie, and MN Foundation for taking time to come in to support the state government in this crisis situation. We wouldn't have been where we were, we would have been better off, but we are where we are by faith. We want to thank you for taking time to come and spend and support us in our services. It is really time and timely to call upon our people to give back to the society, the little the society gave. It's time for all of us as individuals to take time to preach the gospel of cleanliness, to help our younger ones and our children and our neighbors to come to the hospital to access services, to support them buy their drugs, and actually form foundations like MN Foundation to support healthcare services in Gombe State. I would have continued to say so much, but considering this month of Ramadan, I'm only calling upon all of us to give back to the society what is due to the society. At this junction, may I take up my second responsibility. The second responsibility vested on me by His Excellency the Executive Governor of Gombe State. It's not only too big, it's very heavy. The first step is to even wear his crown that has already compressed my cervical vertebrae, but now to flag off this grand occasion. I am flagging off the eye surgery for glaucoma here in Gombe State. I flag off these surgeries Can I invite all the dignitaries, our royal fathers, distinguished guests, to please accompany me to flag off the occasion.
Aku nak yang wajib MKM anti bomba.
Today, 30th day of May, year 2019, I, on behalf of His Excellency, the Executive Governor of Gombe State, do cut off this date to represent official flagging of eye surgeries by MN Foundation to the glory of God and to the benefit of humanity. Thank you. I am seeing from all indications they are now seeing clearly the issue of scratching on the cornea and the conjunctiva is no more there. The issue of inflammation of the conjunctiva is actually subsiding. So the surgeries, the procedure is a success.
Any role played by the state government?
Of course, the state government is the major stakeholder for providing an environment to perform this surgery, for providing an environment where everybody feels free to come, for providing the infrastructure where this surgery is being carried upon, and then planning to continue with this program at the end of this program. When this program is rolled out and is done with, at the end of the lifespan of this program, the state government has planned to continue and sustain the program.
Thank you very much.
Your Excellency, the Deputy Governor of Gombe State, Dr. Obo, the Honorable Commissioner of Defense, Dr. Ishaya Kennedy, the Honorable Foreign Secretary of the Ministry of Defense, the founder and president of Amen Foundation of the region, the representative of End Fund, the representative of the Honorable Minister of Health, the executive chairman of our healthcare development agency of Gombe State, our senior planner, senior district head of Gombe, Permanent secretaries that are here, or the commissioners who are represented by the permanent secretaries. Other protocols duly and respectfully observed. Assalamu alaikum wa rahmatullahi wa barakatuh. Now, on behalf of my senior brother here, who expected me to give the thanks, on behalf of the people of Gombe State, we are very appreciative of the role of the federal government, the state government, and the respected government agencies that have contributed immensely to healthcare development in the state government. The flagging of these trachoma surgery operations that have just taken place is a long way in alleviating the suffering of their people. As far as the people over here are concerned, and I must assure you that with the presence of the senior district head of Gombe, elderly statesman who have been contributing seriously, selflessly to the development of not only the health sector, but almost all sectors of life in Gombe. So with him around, and also closely working with his Waziri, Alhaji Ahmadi, who is coincidentally the executive chairman of the SQR Committee. And my dear brother also here is the singer whose community is very much concerned about the health of not only those particular communities but the entire state. And giving you assurance that as far as publicity is concerned, and sensitization of our forces, this team is a very, very good team, and we are very proud of those teams. Thank you very much. That's it. I have come as a special interest, and having been thrown out, I don't know, of the health program that has been taking place in most health sectors. Sometimes people go to us and programs like polio, some anti-malaria program, and these eye issues. So, that's why the founder give it fit to invite me to be one of the stakeholders for this occasion. So I'm very happy also with that. But you have been a very helpful person here in our state, honestly, as far as this sector is concerned. No wonder you have been the commissioner for several years. And we wish that if there's anything that you should continue as a commissioner forever, so be it. Thank you. Jama'a assalamu alaikum wa rahmatullahi wa barakatuh. Mun riga na yi takaitaccen jawabi a turanci saboda ƙara godiyar da Allah subhanahu wa ta'ala da ya nuna mana wannan rana da wannan lokaci. Muka ƙara godiya tun kan gwamnatin tarayya zuwa gwamnatin jiha da kuma wannan ma'aikata musamman na kiwon lafiya da lura da lafiyar kula da jihar Gombe. Wannan ma'aikata suna aiki ƙwarai da gaske kuma kamar yadda na faɗa in dai aiki ya taso muna da labari ko ba ko muna ɗarukan muna ke irin himma da shi mai girma da irin Gombe yake da shi kuma shi wazirinsa gidaje duk da bayanai da suke yi kuma da mai girma kwamishina yana tsaye a kan irin wannan ayyuka gaskiya muna godiya kwarai duka wanda ke da hannu taimakawarsa aka yi wannan shiri na wato aikin ido da muka kaddamar yanzu muna kowa ya yadda muka taru da lafiya da bai da kowa gida lafiya. Assalamu alaikum wa rahmatullahi wa barakatuh.
Okay, my name is Dr. Nicholas. I'm the program manager for the Nigerian Trachoma Regulation Program, the Federal Ministry of Health.
So how would you describe the program? Sorry? How would you describe the program?
Well, successful. Successful. It's something we all looked up to because Gombe, we've never had something like this in Gombe, a TT program in Gombe, but now flagged off the activity, so work starts.
So is there any role played by the federal government?
Definitely. The federal government will support the state in ensuring that we clear the backlog of TT, tracheasis in the state. It's something we intend to do and we will pursue with all our might.
Of the End Fund, which is based in New York City in the US, and I would rate the success of our partners very highly here in Nigeria and in Gombe State. The Amen Healthcare and Empowerment Foundation, along with the Ministry of Health and the Gombe State Primary Healthcare Development Agency, have done an amazing job of delivering treatment for NTD all across Gombe State, as well as now launching this program to also tackle TT surgeries that are still needed to further progress towards eliminating trachoma in the state. So they've done an amazing job of engaging all levels of the government and the healthcare development agencies, as well as local and traditional rulers, to ensure that everybody is taking the treatment that they're offered across the state, and that we're preventing as many people as possible from going blind due to trachoma.
Any challenges in fighting the diseases?
Of course.
So what are the challenges?
There are immense challenges both in Gombe State as well as at the global level. Everything from when it comes to treatment delivery, there are a lot of logistics, there are hard to reach populations, nomadic populations. There can be issues with treatment refusal. When it comes to delivering the TT surgeries, there's also a lot of training that's needed for surgeons, for case finders, a lot of difficulty in finding the people who need to receive this surgery. The farther this program goes, the more difficult it is going to be to find the remaining few. That's just one of the challenges that we're still yet to face. But delivering treatment to everybody in Gombe State is also a very difficult challenge that they've managed to do a very great job.
What do you think is the way forward to address the challenges?
What
do you think is the way forward toward addressing the challenges that you have mentioned?
I think it's having as many hands on board as possible. Like I said, going in and finding a lot of people in hard to reach areas in smaller communities is going to require not just government support, but local and traditional leaders, community members. We engage community volunteers to help deliver treatments and to help find people who need TT surgeries. So we need all of those people to be willing and able to give hand.
Thank you very much.
Thank you.
Start by introducing yourself and tell us, how do you plan or intend to reach out to the victims of this disease?
Well, I am Rita. I say Aimi Woguntoybo. I'm the founder and president of AME Healthcare and Empowerment Foundation, and we're honored to be partnering with Gombe State with the support of the End Fund and the Federal Ministry of Health and the state government, and working very closely with government institutions like the Primary Healthcare Development Agency and the Ministry of Health and several other ministries that are working and collaborating with us on all our projects, not just the TT project.
So how do you intend to carry out the surgeries?
Well, we have made plans. We already have 4 surgeons that are trained and 8 assistants, and we already have the team leaders. We have a trachoma program manager. We have the eye care program manager, who is the head of the eye care, and the specialist here, Dr. Lawali. And this team have been retrained by the Federal Ministry of Health, and they are ready for work. As you can see, they've started working since 2 days ago. And what we intend to do is to tackle the 5 LGAs with the highest endemicity first. We know that TT, there's backlog TD everywhere, but we want to tackle the 5 LGAs with the highest endemicity first before we move on to the other 6. And we are starting with Yematudeba. The people you see here came from Yematudeba. This is for the purpose of the flag off. We are now going to move into Yematudeba LGA. However, let me tell you that we're going to have a planning meeting tomorrow where we are going to concretize all our plans, but we are going to be dealing with 1 LGA at a time, because the procedure as set down by the Federal Ministry of Health says we must do sweeping, which means we have to ensure that every house in Yematudeba does not have anyone with TT before we leave there. So we're going to go LGA by LGA.
So far, how many surgeries have you conducted, and what is the duration for the program?
Well, we did 116 in January. Now I have to get the total as of today. As you heard Dr. Lawali say, they did 35 surgeries 2 days ago, and I think they did 30 yesterday, and there are a few people earmarked. So for this program, I'm sure we're going to be having over 100 people, but thereafter we are moving into the LGA.
What is the duration for the...
Well, we've given ourselves 3 to 4 weeks to comb the entire LGA. If we find that there are still people, we will remain until we finish. When we finish, we move into the next LGA. And we have 5 LGAs, Yematudeba, Nafada, Funakai, Duku, Kwame. Those are the 5 LGAs with the highest endemicity. Then when we finish, no, not for the 4 weeks. The 4 weeks is for 1 LGA, because you need to comb the LGA. It's not just gathering people, but ensuring that there is no household with anyone with TT. Nobody will be left out.
Thank you very much. Thank you very much.